Hello, today we are going to be demonstrating perineal care on a female resident with hand washing. Hi Mrs. Smith, my name is Katie. I'm your CETA for today. I'm here to help with some perineal care. I'm going to go ahead and sanitize my hands. We're going to check your ID here. Perfect, thank you Mrs. Smith. I'll go ahead and close your privacy curtain. I'm just going to gather some equipment and then we'll go ahead and get started, Mrs. Smith. All right, Mrs. Smith, I'm just going to grab some comfortably warm water for you. I'll be right back. All right, Mrs. Smith, if you can just test the water for me here. Does that feel okay? Great. All right, Mrs. Smith, I'm just going to raise your bed up here for a minute. I'll grab some gloves, and we'll go ahead and get started. There we go. All right, Mrs. Smith, I'm just going to put my gloves on real quick, and then we're going to get the bath blanket over you to give you just some additional privacy while providing some private care here. We're going to bring the sheet down to the bottom of the bed. A little bit closer. What we're going to do is we're going to help get a bed pad underneath you. All right, a waterproof pad just to keep everything nice and dry as we're getting you clean here. So I'm just going to gently place your arm across your abdomen here. I'm going to just help you roll at your shoulder and your thigh here. 1, 2, 3. Thank you very much. I'll help support you. We're going to place this bed pad here just directly behind you and under you. Just going to line it up with the edge of the bed here. And you're going to feel me gently tuck under. There you go, Mrs. Smith. I'm just going to help you gently roll back. Let me help adjust your arm for you. And then on this side here, I'm just going to gently lift your hip and slide through our bed pad so it's all the way under you. There you go. Does that feel nice and comfortable? Great. I take my washcloths and put them in my basin. Mrs. Smith, I'm just going to gently pull up your gown here, and I'm going to gently slide your leg over and place a towel underneath by your legs. Keep you covered here. I'm going to just use your sheet to sort of keep your legs warm to, once again, give you as much privacy as possible. I'm going to go ahead and take my washcloth and use the 4-corner method. So I'm folding my washcloth in half, and in half again, I'm going to apply soap to all 4 corners. All right, Mrs. Smith, I'm going to go ahead and I'm going to start cleaning. I'm going to spread the labia. I'm going to take my first washcloth. I'm going to start urethra and go straight down, making sure to wipe only front to back only. With my second corner, I'm going to continue to spread the labia. I'm going to start at the urethra and clean the far labia, front to back only. And with my third corner, I'm going to go ahead and start the urethra, cleaning the labia closest to me, front to back only. I'll go ahead and cover you up in between here. Just want to give you as much privacy as possible. And now we're going to go ahead and we're going to rinse. So do the same exact thing. You're just going to feel me rinsing now. All right, Mrs. Smith, I'm going to spread the labia. I'm going to start the urethra, go front to back only. Start the urethra, do the far labia, front to back. And then do the labia closest to me, front to back. It's going to go in the hamper. I'm going to go ahead and just dry spread the labia from urethra straight down, front to back only. I'm going to slide this towel off to the side. And we're going to get you situated. I'm going to bring the bath blanket all the way back down. And I'm going to ask for my nurse observer to stand on the opposite side of the bed. So my nurse observer is on the opposite side of the bed just to help for safety. I'm going to adjust the arm here. I'm going to bring the arm across the body here. And Mrs. Smith, I'm going to have you roll towards our nurse observer here. 1, 2, 3. And the nurse observer can hold the mannequin for us. So I'm going to have that nurse observer hold the mannequin. I'm going to place my towel underneath. We're going to use 4 corners again. Now that we're going to do the back side, we're going to put soap on all 4 corners of our washcloth. And we're going to clean from front to back. So where we left off, Mrs. Smith, you're gonna feel me clean from front to back down the center. I'm gonna grab a new portion of the washcloth and I'm gonna do one side from front to back and then the other side from front to back with the new portion of the washcloth. Thank you, nurse evaluator, for holding the mannequin. I'm gonna then do the same thing, just rinsing. So I'm gonna take my first corner here and I'm gonna start the center, front to back. My second one, I'm gonna go off to the side from front to back and then to the other side, front to back. That's gonna go in the hamper. And then I'm gonna dry with a new portion of my towel from front to back only. That's gonna go on the hamper as well. And then we're gonna roll our waterproof pad or our bed pad here and gently tuck it under the patient. And Mrs. Smith, I'm gonna have you gently roll on your back. You might feel a little bump there. And then I'm gonna bring her arm across and gently roll her towards me and bring out this bed pad. So there should be nothing left underneath her. That's gonna go in our hamper. I'm gonna bring the sheet back up. Mrs. Smith, you're nice and clean now. If there's anything else I can help you with, please just let me know. Just gonna gently slide this out, put that in our hamper. Get your gown adjusted. I'm gonna go clean out my basin. So I'm just going to dump the basin water. I'm gonna rinse it out. Gonna dry the basin. Put the basin and anything I have left out in the hamper and back where it belongs. I'm gonna take off my gloves. Gonna sanitize my hands. All right, Mrs. Smith, I'm gonna just go ahead. I'm gonna get your bed in a low position. There's your call aid in your hand. Here are your belongings within reach. Are you comfortable? Do you need anything else at all? Perfect. Would you like your private skirt open or closed? Great. I'll go ahead and close that up for you. There you go, Mrs. Smith. Your bed's in a nice, safe position. I'll get your curtain adjusted. You have a great day. I'm gonna go ahead and wash my hands as I leave. I'm gonna go ahead and come to the sink and get my hands wet. Apply soap. And wash my hands for a minimum of 20 seconds. Making sure I'm getting all parts of both hands using friction. And I'm finished.